Hello, future doctors, and welcome to Twinkle Medications. Here I am Dr. Twinkle. So, in this video, we will discuss about important topics of physiology that will be very helpful for your exam and your medical practice. So, let's get started with me. So, first topic is general physiology and cell membrane transport. Let's start with the basics. General physiology. Homeostasis and feedback mechanisms like negative versus positive feedback. Then, body fluid compartments like ICF, ECF, and blood plasma. Then, membrane transport, diffusion, simple and facilitated. Then, osmosis and tonicity like hypertonic, isotonic. Active transport, sodium potassium ATP is pumped. Then resting membrane potential and action potential. So remember, the sodium potassium pump maintains a resting potential of about negative 70 millivolt in neurons, which is crucial for nerve signals transmission. Then second topic is nervous system and neurophysiology. Now let's move to one of the most asked topics, that is neurophysiology, that are neuron and synaptic transmission like types of synapses, neurotransmitters, reflex are monosynaptic and polysynaptic reflexes. Then autonomic nervous system, sympathetic versus parasympathetic, CSF formation and circulation, brain blood supply like circle of Willis. A common FMGE question: which neurotransmitter is released at the neuromuscular junction? The answer is acetylcholine. Now move to third topic of physiology, that is cardiovascular system, heart and circulation. Now let's understand how the heart pumps life into our body. Cardiac cycle and heart sounds like S1, S2 murmurs. Cardiac output. So cardiac output is the product of heart rate and stroke volume. Now Frank-Starling law, that is preload, afterload, contractility, and blood pressure regulation like baroreceptors and chemoreceptors. After that, RAS system, that is renin, angiotensin, aldosterone system. After that, ECG interpretation like PQRST wave and arrhythmias, shock and its types like hypovolemic, cardiogenic, septic, and neurogenic. So, a simple tip: FMG often asks about which phase of the cardiac cycle lasts the longest. So, answer is diastole. Let's move with another topic, that is respiratory system. Breathing seems simple, but let's break it down physiologically. So with mechanics of breathing like lung volumes and capacities, compliance and airway resistance, gas exchange and diffusion like oxygen transport in blood. After that, most important topic, that is oxygen hemoglobin dissociation curve, factors affecting it. Then hypoxia and its types like hypoxic, anemic, stagnant, and histotoxic. Regulation of respiration, that is central and peripheral chemoreceptors. A frequently tested FMGE topic: what shifts the oxygen hemoglobin curve to the right? So the answer is increase in carbon dioxide, hydrogen, temperature, and bisphosphoglycerate. After that, move to another topic, that is renal system and acid-base balance. Now let's understand how our kidneys maintain homeostasis. So topics are glomerular filtration rate, GFR, and its regulation. After that, renal tubular functions like proximal tubule, loop of Henle, collecting duct. After that, acid-base balance, metabolic versus respiratory acidosis versus alkalosis, electrolyte balance, sodium, potassium, and calcium. After that, RAS system in BP regulation. An important FMGE concept: the primary site for sodium reabsorption in the nephron. Answer is proximal convoluted tubule. A very important topic from this system. Now move to another topic, that is endocrine system and hormones. Hormones control almost every function of our body. So let's understand them. First one is hypothalamus pituitary axis. After that, thyroid hormones and their functions like T3, T4, TSH, insulin and glucagon. Most important topic is diabetes mellitus. Then adrenal hormones, cortisol, aldosterone, epinephrine. Then calcium metabolism, that is PTH, calcitonin, and vitamin D. So, frequently asked which hormone increases blood glucose levels during stress? Answer is cortisol. Then, gastrointestinal system. Let's move to digestion and metabolism. Gastric secretion and phases of digestion, functions of the liver, bile production, detoxification, pancreatic enzymes, and their role in digestion. GI hormones, that is gastrin, secretin, CCK. Did you know the most potent stimulus for gastric acid secretion is gastrin? After that, blood physiology and hematology. Now let's talk about the lifeline of our body, that is blood. So RBC, WBC and platelet functions, hemostasis and coagulation cascade, blood groups ABO and RH system, hemoglobin and oxygen dissociation curve, common anemias and their pathophysiology. A frequently asked FMGE question: which clotting factor is deficient in hemophilia A? Answer is factor 8. Now move with another topic, that is reproductive physiology. Reproduction is a crucial part of physiology. Let's review the key concepts. First one is menstrual cycle and hormonal regulation, spermatogenesis and oogenesis, pregnancy physiology and fetal circulation, parturition and lactation hormones. FMGE tip: which hormone is responsible for milk ejection? Answer is oxytocin. Let's move to another topic, that is temperature regulation and exercise physiology. How does our body adapt to different conditions like mechanisms of heat gain and heat loss, fever and hyperthermia, effects of exercise on the cardiovascular and respiratory system. Quick fact: sweat glands are controlled by the sympathetic nervous system, but they use acetylcholine as a neurotransmitter. So done with this.